in healthcare specifically, the risk appetite is still very low. Okay, so for the startups, then the challenge is, okay, on the one hand side, we have these high expectations, this forward thinking that we actually want to look into where our solution can tap into, but how do we actually deliver this? So there are many unicorns that came out of venture studios because your time to market is 2.5 times faster. Your survival rate is way higher, especially in the early stage, right? But it's also not easy, to be fair, right? So to switch that full mindset, to get your hands dirty again, build all the presentations yourself, right? It's different, but it's very rewarding at the same time. Everyone wants to do health tech, but then only once the risk is minimized. That's why, for example, then we said, okay, we just bridged that entire pre-seed thing. We bootstrapped it ourselves. And then now we're hitting seed. So, I mean, AI it's in every industry anyway, right? And I think it's one of the technologies that finally moves the needle faster, even in healthcare, because there's no way around it. If I would go to a corporate venture capital arm, I would do way more due diligence in the beginning, because the corporate venture capital arms are always very much tied to the strategic areas of the corporate, right? And you really want to do the research on, do I really fit into one of these strategic pillars that they have in the webpage, and not only broadly fit, but very specifically.
Hey founders, ready to match with your next investor? At lucidityinsights.com, we've built the Middle East's first Tinder for startup founders and VCs. Explore 800 verified VC and angel profiles, see who they're funding, and send your pitch deck directly, all in one place. Stop waiting for introductions. Make your own luck at lucidityinsights.com. And for a limited time, get 20% off your startup registration with the code TPP20 at checkout. Welcome to this episode of The Perfect Pitch. It's my pleasure today to be sitting across from Florian Krueger-Herbert, who is an entrepreneur turned healthcare investor. Well, and you've had some Fortune 500 experience at some of the biggest healthcare companies in the world over the last 7-8 years.
Yeah.
Florian, welcome.
Thank you very much for having me.
I'm excited about this conversation today because we can jump around because you wear many hats.
Yeah.
And everything to do with healthcare and health tech.
Yes.
Let's start with you giving us, if you can, and as short as possible, sort of the summary of why healthcare has called you, what that journey has been, all of the different hats you've worn, and then where you are now and what's brought you here.
Yeah. Look, it's, to be fully honest, I dropped into healthcare about almost 16, 17 years ago, but by pure accident, right? I was coming back from the States. I had to finish my study program, right? I was always in FMCG. At some point in time, even marketing mops and brooms, right? For a household company in the US. So came back to Germany, but on the way back, I met someone who was working for a pharmaceutical wholesaler and saying, look, we're looking for someone who literally can build strategy on private label in pharmaceutical wholesale, right? And this was at a time when the most sexiest thing in the market could even be an online pharmacy, right? We're not even speaking anything about digital health yet. And spoke to that person just to figure out that her new boss was one of my first internship boss in South Africa, way before my career, right? So I went back home, grabbed my bags, moved all the way back from Hamburg to Stuttgart. And that's how I got into healthcare. And then I've been there for about 1.5 years and really started seeing something that this could be a long-term thing that at some point in time definitely needs digitization, right? So I did it for 1.5 years. Everything was BI centered, a lot of data, because as a wholesaler, you see everything going to the pharmacies, going out of the pharmacies. I mean, perfectly. But then I left because in parallel, I was building an app on Facebook. So it was still the time when you can do apps on Facebook.
When was this? Like 2010?
2010, yes, 2010/11. And simply built an medication reminder service, right? Connected to a phone where it was sending out SMS services. You can take in what kind of medications you're taking. Got some traction, and then thought, okay, most likely I'm going to be the next Mark Zuckerberg of healthcare. So I left that good corporate job and did my first startup, which turned into a digital health record. So between pharmacies and patients was a web-based solution, interaction checks, all that stuff. But as said, very early and at a time where you did not have really all those cool hyperscalers, easy to set up, right? And then there was a data privacy law change. So the bridge round became bigger and bigger. So at some point in time, just closed it down and went corporate entrepreneur. But since I've now been in healthcare, deeply into pharmacy, Philips at that time was looking for a person who can build up their pharmacy channel, right? So joined Philips, built up the pharmacy channel, was even like key account manager for Toys R Us, selling baby products at some point in time. So very diverse role. But then they got a new product category, and that category was a medical grade certified watch, and it came out before the Apple Watch came out.
Interesting.
So, but what it did was it had heart rate measuring, all those typical things. And then they said, okay, what are we going to do about it? So I built like a business around it for Germany, like connected to prevention apps. So we had diabetes, obesity, all that stuff. And then over the years grew into a fully fledged telehealth business, right, for COPD patients, atrial fibrillation. So always on that intersection of the cool technology and the still very old and slow healthcare system, right? And at some point in time, I was trying to sell a patient-reported outcome measurement solution to Johnson & Johnson, innovative medicine, in the middle of Germany. And while I was going out of that meeting from J&J, I got a call from a recruiter from Johnson & Johnson MedTech. And he's like, hey, we're having this super cool job. And it sounded so technical, to be honest, right? And I'm like, nope, that's not for me, right? Let me do something else. Because at that time in Philips, I already was like, I want to do my own thing again, right? So it was that spark was already there. And then the recruiter called again. He's like, no, I want you to meet this person, right? And I spoke to this person. His name is Alexander, right? And he was doing all this cool startup and innovation work for J&J, right? And there was this, and out of San Diego, so California. So it, and if you look at his profile, I was like, okay, if I ever gonna learn something again about like international startups, how the investment world works, all that stuff, right? That's someone I want to work with. So joined J&J, worked a lot on digital surgery, robotics, all that stuff, and then moved from medtech to innovative medicine. With that move came also the move to the UAE, right? So I've been here now a bit over 3 years, right? They always say 3 years is the tipping point, whether you stay or don't, but I definitely stay. And then worked a lot on lab automations, AI and drug discovery, all those cool things again. Again, business, technology, but the yet faster moving healthcare ecosystem than it was like 15 years ago. And now I'm full entrepreneur again. So I just left. And so I originally finished my role with as technology innovation head and also for venture building. And for me, it was only normal that I'm now going to build a venture studio for HealthTech out of the Middle East. So our motto is we build them here, but then we scale them globally. We just launched the first venture in the gut health space. I have a super cool co-founder. She's ex-Plug and Play. Luisa Chituru is her name. She's been here 10 years. Also knows the region inside out. We have amazing strategic advisors like Dr. Dirk Richter from Abu Dhabi. He literally was the innovation director for multiple years at the DOH. Like he's been involved in all the digital health topics. Tim, who's been with the Investment Authority in Oman. IQ, he's the ex-VP at Careem, Meta for the tech piece. We have Dr. Shafiq from Cleveland Clinic. He's the head surgeon for robotics. So we do have our partner in the US for like the scale-up things. So it's it all comes together, and that's what I'm doing now. So I'm building this venture studio with a full-fledged fund, taking companies all the way to Series A. And
I love it.
besides that, I partnered with an early stage venture university in California. So that's what I do.
Wow. Okay, we're going to talk about that. When I sit and listen to your life, your career flashing before our eyes, I realize a lot of it seems very serendipitous. A lot of mentors and connections, that just feels a little bit like you're following the right current. Some people like plan in their head what they want to do and then go out and get it. And you strike me as someone who really feels for what opportunities are there and you follow what's alive. And whenever I hear people talk about their careers, it's those people that tend to move quickly and grow quickly as well.
You have to follow what you love doing, right? And it's always easier said than done. And now in hindsight, that entire career pathway absolutely makes sense, right? Sometimes you're like, okay, what is it actually now that you're gonna do next? But it has always been around the people that I met along the way that actually got me into the next endeavor, adventure that I'm gonna do.
And for those people that are like, oh my gosh, this sounds too good to be true, I'm sure there have been moments where you've also been like, I don't know what I'm doing next. Is that right?
Always.
Yeah.
It's because even if you go through a corporate world, and everyone always says, okay, if you are in corporate, everything is always, it's comfortable, 100% safe, etc. I think
cushy,
that corporate,
you can get a little stuck there.
But I think that changed too over the past couple of almost 2 decades.
What has changed from working in Fortune 500s?
The speed is faster, and sometimes strategies are more short-term strategies becoming. So a lot of things change, right? And you always have to be very open-minded to just adapt and then do the next thing. And if you do not like faster moving paces, even in corporate, right? Although everyone always says corporate is slow, then you're gonna stay where you are. But then the question is, do you want to develop further yourself, right? Is that everything you want, right? And for me, I always wanted to do something next, something new. So I had that every couple of years. But even from a self-learning point now, also with like venture university from the States, there was always for me this myth around this Silicon Valley thing, the startups area that I wanted to better understand. So it's just normal progression that you have to move, and especially here in the UAE.
Yeah, so I want to touch on that as well. It's interesting because earlier you said, I worked at the intersection of like the coolest new tech with old school healthcare, slow legacy systems. And anytime I hear anyone talk about health tech, that's what I hear. Like nothing has changed. It is one of the most archaic, slow, incumbent, particularly in the US with insurance and whatnot. It's really hard to crack for founders to work in health tech and have it work with the legacy systems that are already in place. Do you see that happening here as well? Or do you feel like it's a little bit faster here or there's different mechanics in place?
It depends from what perspective and what level you're looking at, right? I would say in general. So for example, if you come in general, if you go to all the different government entities or if you go to hospitals, me personally, I would say the discussions you're gonna have are way easier than you're gonna have in somewhere else, right? Even in the past couple of years, the discussion's always been around, hey, we do have certain data, can we do a research project on it, right? How is AI actually going to work in that setting? All that kind of stuff. But if you come from a startup perspective, you would also see that, yes, people are way more interested, but the challenge for the startups is that when you look at our ecosystem, we do have this very good pre-seed, seed stage investments for fintech and proptech and even fintech, very regulated, but it's been a built-up ecosystem already over the past couple of years, right? But in healthcare specifically, the risk appetite is still very low. Okay, so for the startups, then the challenge is, okay, on the one hand side, we have these high expectations, this forward thinking that we actually want to look into where our solution can tap into. But how do we actually deliver this? Because you might have an MVP, but it might not be yet fully fledged ready for a large hospital chain, right? And there's still this gap that needs to be bridged, where we, on the one hand side, from investors, need way more risk-taking approach in order to fund these early stage startups. But then once that actually happens, then I think it is moving way faster over here than in some other countries.
Do you think it's not just that investors over here, when it comes to healthcare and health tech, need to have a bigger risk appetite, but also potentially deeper pockets? Because there is this, I feel that whenever I talk about health tech or healthcare in this region, there is this sense that compared to other blank tech, whatever it is, health tech and healthcare have higher capex, longer, return cycles. There's a lot more R&D and investment involved, and it is a lot higher risk. Is that true?
It depends on what you build, right? Yeah. If you say that the next clinic that you want to set up is the innovation that you want to bring, then yes, you might have some high capex and all that kind of stuff, right? But if you look at it from a digital perspective, we have a lot of good research in this country. There are excellent researchers down in NYU, Abu Dhabi, etc. So if you take the research knowledge, you, for example, compare it with AI, similar like we're doing in one of our ventures, Gut Guru, and build a fully fledged B2B2C approach out of it, specifically for data or for the people living in this region over here, right? Because if you look at gut health, all existing research data is based on Western population. So that's one of the reasons why we did it here, because we're having the local data, we are getting data from Asia, we're getting data from Africa, right? So completely different data set. But this helps you in different healthcare pathways down the road, right? And if you focus on these business models, and then they are not only for here, because then you can take them and plug them in anywhere else in the world, then you would have a higher upside, higher return. It's less capex, right? Because there's a lot of research existing. It's just a matter of how do you take the research now and that IP that sits with many of the universities you have here and actually commercialize them, right? If you look at the US, many of the universities have done that successfully over the past 20 to 30 years. That's a model that has not been really existing yet here, but definitely one that is very interesting moving forward.
Okay, before we get into your new ventures, of like investing in new ventures and starting up your own new ventures in the healthcare space, considering you've had this experience in the US, in Europe, and now for 3 years here, and it sounds like you're doubling down on the region, I'd love your perspective on what's the difference between the healthcare market in this region versus your experiences in Europe or Germany and in the US? What are you seeing, and where are the big sort of gaps as well that future health tech founders, or even within your venture studio, you guys hope to take advantage of and fill those opportunity gaps?
One thing is regulations, right? That's one. Although I also have to say that the regulations we hear are way more future forward thinking, right? When you look at all the different things when it comes to AI, etc., a few more things are way more regulated. There are clear pathways that you can run through, etc.
There are clear pathways for health tech, AI research, those sort of things in the UAE than Europe and the US?
That's my thinking, because you have all those different sandboxes, right, that you can look into. There are different entities that you can speak to, specifically again when it is about research, getting the anonymized data and all those things. So from that perspective, yes. Is it already from the beginning then easier to start here? Again, goes back to the early stage funding. That's a different challenge, because top talent also usually here is very expensive, right? So that's a difference if you compare it to Europe, etc., because you also have these great hubs in Lisbon, you have this emerging biotech hub in Munich, etc. So there are different structures.
So just to be clear, are you saying that top talent or equivalent talent in Europe could be cheaper than in Dubai?
Yeah, because the cost of living here is way high.
Interesting.
Yeah.
Yeah. And I assume just because of the population being much smaller here,
Yeah.
there's just that scarcity. While there's probably a huge influx of them in North America and Europe, and they're all fighting for the same jobs. Interesting. Okay. What else?
Going back to the pre-seed, seed investment scene, it's far more developed in the US. Now even Europe is picking up. I've seen a lot of deals lately in seed stage for all these biomarker testings and some other solutions, right? That you see in the market, where even in Europe you have like 3 million seed funding rounds. That's something that is unheard of here, right? In the different other sectors, but not in health tech. So yeah, I think that sums it up.
And then in terms of like level of innovation, where is the region compared to, let's say, the West?
I would say at the forefront. If you look at everything that is happening with all the AI investments, if you look at all the stuff that G42 is doing in Abu Dhabi, right? The ecosystem when it comes to new innovations. I was just at an event on Monday called AI in Dubai. And there were different individuals presenting on what is happening when it comes to security. So with a lot of blockchain, when it comes to AI, again in real estate, but then also there was a certain sector on healthcare. And if you look at what is happening there, what the entire country is doubling down on from an investment perspective as well, then I would definitely say at the forefront. If you look at the University of Artificial Intelligence in Abu Dhabi, the talent they have is incredible, right? But they also have access to all these cool technologies from NVIDIA, right? Supercomputers, everything. So yeah, at the forefront.
Interesting. Okay. And let's start with Gut Guru.
Yeah.
This is your first investment out of 10-foot venture studio, your new venture studio. Actually, let's start with describing what is a venture studio. A lot of people have different impressions of what venture studios are, how they function.
Yeah.
Why develop a venture studio here, and why is it relevant for the founders, that health tech founders out there, or people that are interested in health tech and working for health tech for the region?
So in 10 Feet Ventures, we have a very hybrid model, right? So I always say we have two engines. One engine is where we have the corporate innovation service piece, where we work with corporates, and we literally, as a corporate, you can outsource almost any innovation activity that you usually cannot do as a large corporate because you're either too slow, your processes don't work, etc., right? So the typical things. But we also do the corporate venture building in there. So if a corporate sees a market trend, needs a solution for that, there's no startup directly existing. So we're coming up with ways on how you can sponsor the build of such a new company. You still have like first rights of purchasing, then getting in later with equity, etc. It depends on how flexible the corporate is with being involved to what extent.
So you have relationships with a number of healthcare related corporates in the region.
Yeah.
And basically you're acting as their scout?
As their scout, but also, for example, we're now doing one innovation challenge from January until mid of April with a couple of entities. And there the corporate gives the challenges, and then we do it together with MBZ UI as well, and the students build the POC, and then after that, if the POC actually solves the market problem, then the venture studio would incept the company, right, and then the corporate can become the first paying customer of that startup, right? So it also minimizes the investment risk for angel investors, right? So it all goes back to the point, how do we get more money early on into pre-seed and seed? So that's one engine. The other engine is our typical venture studio bread and butter business, where we take ideas all the way from inception, ideation, to product market fit, right? And Gut Guru, for example, was the first one. We had no external capital at all. We completely bootstrapped it. So we did the full market research on what the market actually needs, and it's all around gut health, right? So, and if you look at the UAE, but in general the GCC, if you want to do a gut health test, and everyone should do a gut health test because it really determines your entire body health, right?
Yeah.
So even there's a brain-gut connection as well. But without going too much into that topic, you have 3 problems here. The one is either you don't know about a gut test, so awareness. If you know about a gut test, the average cost is around 4,000 dirhams, right?
I didn't even know you could get one here. I remember during COVID doing a lot of research and wanting to get one. And every one that I could find that was strong would be shipping from Europe or from the US.
Yeah. So now you can. Also, there are multiple offerings now.
Okay.
But
they're expensive.
Expensive. You can do ours if you want to. But
how much is yours?
So with all the automation that we did, we brought it down to 2,000 dirhams.
Oh, wow.
In order to start with.
Are you guys already
yes,
in the market?
For a couple of weeks now, that first venture has been generating revenue from day one. So now we're doing a seed round, like the proper typical startup way as part of the studio. And so the cost was the second problem. The third problem is, even if you do a gut test, you get a report that is like 120 pages PDF.
Right.
You don't understand it.
Yeah.
Right. And so what we did is, on top of offering you the gut testing, so we brought on board Chief Scientific Officer. His name is Ashish. He's been on Netflix. He had his own documentary called Hack Your Health. So he's the person over here when you want to speak about gut health. And
he lives here.
And he lives here. He's also a professor at NYU Abu Dhabi. So that's why we also know there's great talent too. And he's been one of the first ones who's been researching. He actually came with the Melinda Gates Foundation grant to the UAE, right? So he's been one of the first ones to even research on the Emirati population. So that's, again, back to the topic. Everything existing is on Western population. How do we build in the cultural specificities when you get such a created report, right? So we built up that entire model from a research perspective, but then we put an AI on top of it. So now when you do the test, you can interact with the typical ChatGPT one, but it's trained on our research information, certain publications, etc. You ask questions, you get all the answers. And if that's not enough, then you can have an additional consultation with the doctor.
Interesting.
And this is what usually is missing when you do a test. You're missing that additional step where you can actually then discuss treatment, diagnosis, all those things. And for the doctor, we created a doctor's dashboard, because we work with a lot of doctors that are now referring their patients because they really liked what we built from an insight. It's all about the insights. Everyone can generate a report, but the insights that you built based on the model we did with Ashish, for the doctors was so valuable that we're getting more and more referrals. But for the doctor also, typically when they refer a patient to do a lab test, and the patient would go anywhere because he does some researching on pricing and all that stuff, it can be that he never comes back because the lab refers you to a different doctor. Right? So with us, it's a closed loop system. So the patient knows that, the doctor knows that, everyone sees the same information. And that's the first one we built.
It's fascinating. And I love it. I will definitely become a customer. But what's interesting also is that this is not a typical approach into a venture studio, right? Because you were mentioning earlier off camera that the majority going forwards, it wouldn't be like an outside founder that's already built something that comes to you and you guys start working on something. It would be you guys coming up with the idea and then going out and recruiting the right CEO or whatever for it.
100% ideal setup, right? The venture studio already would have a fully fledged fund behind it, right? Since we wanted to prove that this model actually is working, etc., we bootstrapped the first one. But let's now assume the fund that we're currently raising is already behind it. Then
how much are you raising?
30 million.
Okay.
And if you build a startup in healthcare and you get to product market fit, you're on, let's say your average capital injection is around 750,000. Right? If you want to do it right. So we would have deployed that then already into Gut Guru. Now we completely bootstrapped it because we wanted to show this model is working as well. So for every next one that we're going to build is we immediately inject the capital. We take them all the way to product market fit. And when we hit the product market fit milestone, this is then when we reduce our equity and we actually bring on board the outside co-funding team, right? Can be then the CEO, the COO, depending on what the startup then actually right now needs. And then it's up to that team to secure outside funding, to literally take it like a normal startup. But if you look at venture studio models, and I think one of the most prominent ones, although I think they call the studio a little bit differently. There's flagship pioneers in the US. They actually built Moderna, right? So the model is working. There are others, like I think it was even I saw a new TV show. I think it was on Disney about Tinder. Right, came out of a studio, right? So there are many unicorns that came out of venture studios because your time to market is 2.5 times faster. Your survival rate is way higher, especially in the early stage, right? Because
and why is that? Is it because you have this board of advisors? What's the deal?
Because you usually have venture studios that are industry specific, right? So yes, knowledge is the one piece, but when you have a venture studio, you're building up on, for example, the technology stack that you already have. So, for example, now we did Gut Guru. We are able to reuse the same technology now for a pet care one. We are able to reuse certain things of that for a biomarker testing solution that we are exploring. So, time to market is faster. You figured out already those little nuances that might go wrong with the next one. If you build a digital health one once from a data privacy perspective, a regulatory perspective, it's almost 90% the same process again, regulations-wise, unless you have a completely different business model for the next one, right? So you build up on a core foundation, not like founder A, B, not knowing each other, having different companies who have to do everything from scratch again, right? So that reduces failure rate, increases time to market. For the investors, it's interesting because they're getting a full portfolio, not only investing into one, right? So it's also a long-term game.
Is my understanding correct as well that in venture studios, the reason why a lot of the synergies are that admin, marketing, maybe some of the back office things are also all centralized. So when you end up having 20 startups, let's say, coming out of that venture studio, almost everyone shares this back office that's working, you know, on accounting and all of the basic things.
I mean, at some point in time, when you cross certain thresholds, yes, as a startup, you also have your own marketing team and all that stuff, right? But there are nuances to it as well, right? Many people don't like the venture studio model because if you blow it up too much, it can become a very huge overhead cost factor, especially if you put it on top of a fund, right? If you have like all of a sudden a 10 people marketing team, 100 people development team, it almost becomes financially not very interesting. But now, if you look at this entire process from ideation to prototyping, we perfectly used AI to automate so many steps in there, right? So, and with that first engine where I said like this corporate venturing piece, that service piece, it allows us also to offset many costs on the venture building piece, so that actually this model on top of a fund becomes financially way more interesting and reliable than only having a huge overhead on top.
Do you already have your next venture ideas in mind?
The one actually is in pet care, and the third one is going to be in the blood biomarker space.
Interesting. Okay. So very, very...
but you see, it's all also linked.
Similar to Gut Guru.
Yeah, because when you do a gut test, you might want to test certain biomarkers as well. Yeah. Right. But there are also certain things then that you can differently, etc. Also decrease costs. It's all about the access to care, the good quality of care, etc. that you're getting. So those are the ones we're looking into. Interesting.
Yeah, because I would imagine that you already have some of that distribution channels already set up. The clinics might be the same.
Labs might be similar. Yes.
Right. Yeah. Interesting. Okay.
So you already see how it's all interconnected.
And when do you... So walk me through this. So for example, this pet care one, if you guys are launching that next, you have an internal team that's done a bunch of the market research, put the business plan together and whatnot. Are you guys going out and then doing that, or you are then going out and hiring someone to lead this?
It's all comes down also to the first point on the fundraise for the fund, right? But let's say on the pet one, since we do have the tech, we do know how to go to market. It's going to be way more straightforward to find a either fully fledged CEO then, or a fractional CEO for now, or even a person that then builds it out, starts with the A/B testing to see, okay, what actually works better to really prove the product market fit, and then go into the next stage.
And when you hire these sort of executives to run these new startups, do they get equity?
Yep. Yeah. Always. It always depends. I mean, it's, again, like in any company, then it's a one-by-one decision, right? Also on the profile you want to have, etc. But the interesting thing now is there are so many 35 plus, 40 plus, even corporate executives, and especially also then from the own network, etc., that all are at this tipping point. We want to do something with a purpose, something different, etc. That are thinking about, okay, what is going to be my next step? Can I come in fractional, right, until it is fully developed, and then, okay, I could leave my corporate job, but I already have my thing on the side. And to be fair, we have more requests of people wanting to work on either the venture studio or any of the ventures than we currently could allow for capacity financially.
I meet someone every week that's left their corporate job and just, ready to strike out on their own, take a little bit of a break and really figure out what they want to do next. But it's exactly this. They want to do something that's more mission driven, something aligned to their passions. And so, I think you're in a bit of a sweet spot.
Yeah, but it's also not easy, to be fair, right? So to switch that full mindset to get your hands dirty again, build all the presentations yourself, right? It's different, but it's very rewarding at the same time.
Absolutely. Very interesting. Tell me a little bit about this Venture University partnership.
So that's another good one. It interlinks, right? But I told you about why I moved to J&J, spoke to this person who's been like in this innovation space in the US, right? And I think for everyone that is always out there, it's like USA, Silicon Valley, right? The entire myth about venture capital, the startups, the unicorns. And it was about September last year, right? So a few years ago, I looked into venture studios already, and there was a guy, his name is Andy Goldstein, and he was a partner at that time at Deloitte for venture building, right? So that's how we first got connected. And then in September, I saw one of his LinkedIn posts. He's like, hey, I teamed up for EMEA with Venture University, etc. This is what we're doing. And Venture University is a fully fledged VC accelerator program, right? It is a
VC accelerator, so not a startup accelerator, but actually building a venture capital.
Yeah, it is for everyone who wants to be an emerging fund manager who works in a corporate venture capital setting for a large corporate, who has something to do with innovation, has been angel investing, works in a family office, but if you look at the VC space, and maybe now people might disagree, but there is no proper school of business on how to do angel investing or VC, right? So they built this entire curriculum. It always runs on cohorts, but it's not a theoretical approach. So it's very hands-on. You do things like Startup Madness, where you screen 100 startups, right? You need to capture on that entire deal flow that is assigned to you. So for background, Venture University is part of VU Venture Partners, right? And the two partners, Andrew and Skyler, they have like over 25, 30 years experience, right? So Sky...
They're based in San Francisco.
Sky built up the corporate venture arm for Simon Real Estate. Andrew has been at a large fund, I think 1.5 billion in NYC. But both of them, since they've been around so long, they've always focused on pre-seed stage, and they've been the early investors in many of the companies like Venmo, Databricks, Facebook, Uber, Figure AI, right? So like literally every household name that you usually see somewhere on the news, right? And they came up with this entire cohort program. So you are in there, part of your tuition gets reinvested into the deals that you are making. There's a huge syndicate.
So you're actually investing in
so
the
you
deals?
You are investing, right? So you are investing with VU's money into those deals because that's their business. Every Monday there's a partner meeting. You are in this partner meeting. You are representing the deal flow. So I signed up for this cohort last year, September, October.
Like 2025?
Yeah, 2025.
Okay.
Interesting one, because over here with the time zone, it's a 12 hours time difference, right? So you do night shifts and then you have your normal day. But the people, so they have a pretty good due diligence process as well on who's in those cohorts, etc. But the people you meet in there, even like Andy, the partner for EMEA, besides that he was a partner at Deloitte, he already exited, I think even twice, his companies in the late 90s, early 2000s, software businesses. He built up the German accelerator, very government-driven approach for innovation. Then there's another guy, he ran a venture studio where the anchor partner was a pharmaceutical as well. I think 80 or 90% of them have been very successful of the ventures that they built.
Is it healthcare centric?
To be fair, no. They look at 6 different verticals.
Okay.
You also have fintech, all the different
Prop tech,
areas, space tech.
Oh,
and
interesting.
so you see also in the frontier space, you see all these cool new startups coming in, right, that build data centers in space, etc. So you get
orbital space centers. Everyone's talking about them.
Yeah, and you see it all there, right? And then you speak to these cool founders as well. And so the people you meet in this cohort, that's also on a different level. But for me, I always wanted to demystify that thing about, okay, how is it actually working in Silicon Valley? Since I don't live there and I'm based over here, that was my best access. And it was, I think, one of the best things where I put my money in the past couple of years, because as much as you put in, the more also you get out, right? But network, the insights, then now I'm doing the second cohort, but I also signed up with them for the strategic partnership for the UAE, because if you are in these meetings, rarely you're getting asked if a startup is pitching, or as a startup you're getting asked if you are pre-seed, hey, what's your revenue, right? When I go to investor pitches, etc., that are saying they are early stage, and we were still pre-seed with Gut Guru, like, okay, what's your revenue, etc. So it's a completely different perspective, I would say, that they apply. So, and now we're trying to bring that over here with the accelerator program as well.
Well, just to be clear, I think in the past, maybe that wasn't a question that was being asked, but my hunch from all the conversations is that, you know, pre-2020, pre-COVID, there were a lot of pre-seed, seed stage investment where you could be pre-revenue. You didn't have revenue, and people would go back of the napkin, what's your idea? Yeah, that sounds like a great idea. I'll fund you up until this point. But then, of course, everyone got scorched during COVID. And I would say it's particularly heavy in the health tech space because there were so many high valuation investments happening during 2020, 21, 22, and even globally. I would say the health tech investing hasn't fully recovered, right?
Yep.
And there's this. What do you make of that recovery or lack thereof? Do you think just overinvestment over the last few years and people just lost their appetite?
No, I think it's ramping up again now. If you look at, but again, mainly then the US, if you look at all these business models from Function Health, superpower.com that are in the blood biomarker, preventive care area, etc.
Yeah.
I mean, there was one that just did like a 30 million raise. Right, also been around only for 1.5 years, for example. So no, I would say it's picking up, and also to what I mentioned earlier in Europe, where you now see seed rounds of 3.5 million, 4 million specifically in that space. That's also something for healthcare that was untypical. So is it pre-COVID times? Maybe not yet, but that depending on the geography, I would say, but definitely picking up again.
And coming back to that, so yeah, one of the biggest issues that startups seem to have in the region, and we hear it even from some of the investors themselves, is that the definition of a pre-seed seed here is not the same definition as pre-seed seed in, Silicon Valley. When I was at Stanford, you could get a $5 million check with just an idea, barely a pitch deck. You know, they're like, yeah, sure, we'll give you some money, get this off the ground, sort of thing. That has also changed in Silicon Valley, though. I have heard that it's gotten a little bit tighter as the cost of capital has gone up. But here, what the impact was everyone said, if you don't have traction, we won't fund you. But they said, but we finance pre-seed. And you're like, well, how is it pre-seed if you already have traction? And so there's this.
I think that's still the same, to be honest. But that also was one of the reasons why we're doing this thesis for the venture studio, because then with the venture studio you can perfectly bridge that time frame from ideation all the way to product market fit. And by the time you get to Series A, yes, you have a lot of PE funds and sovereign wealth funds, etc. But yeah, that was one of the main reasons for that thesis. As well. And
my understanding is for Gut Guru, you actually did spend several months trying to get VC meetings and trying to get funding. I want your honest opinion. What was your experience trying to fundraise for HealthTech in the region? What's your vibe of like, how investors feel about HealthTech, whether they're really investing in it? What's happening?
Yeah, everyone wants to do HealthTech, but then only once the risk is minimized. Right, so that's a little bit my take on it, and I mean, everyone can also reach out if they disagree and prove me wrong. But that's why, for example, then we said, okay, we just bridged that entire pre-seed thing, we bootstrap it ourselves, and then now we're hitting seed. Right?
Was there just no traction? Was there just no, like, the conversations didn't go anywhere, or
there were conversations then where like the terms were ridiculous, right? So that's one. But then also many literally.
Can you say what, like, when you say terms were ridiculous? What's a ridiculous term?
It's then usually when the let's say we always do safe notes, right? And some wanted then immediately the equity, right? So that's one. But we were really picky on just sticking to the safe note thing, right? So that was one. But then on general, it's going to that point where I said everyone wants to do healthcare, but only when it is minimized. Some of the conversations led to very good B2B introductions as well, right? So you cannot say it doesn't go anywhere, but I would say for everyone in the pre-seed stage in healthcare, it's just still challenging.
And also there is this question, like a lot of people have been sort of theorizing that a lot of the VCs that claim to have a fund to invest, their funds are open, but some of them are actually actively deploying externally. They're kind of saving it for their current portfolio to try and bring that up. And so
but that's also okay, right? Because that's what every fund
of course
does, so.
But that makes the fundraising really challenging for a lot of startup founders that say, well, I have a good idea, I had a really great conversation, and nothing is really happening. And it just does seem to be a little bit of a black box for people. Now let's talk a little bit about AI and HealthTech. It seems to be AI in everything. I'm curious, is it really moving the needle in HealthTech? Is it being integrated in ways where you're like, this is really going to change things in the next 3 to 5 years, or are we still dilly-dallying around the corners?
No. So, I mean, AI it's in every industry anyway, right? And I think it's one of the technologies that finally moves the needle faster, even in healthcare, because there's no way around it, right? Is it going to be the holy grail? No, but you see a lot of new use cases already. So besides the new releases of ChatGPT Health and all those things, but
there's a ChatGPT Health.
Yeah, it's just been released.
Is it like your own medical advisor,
etc.? Not sure if you can fully use it for that, but that's the thing, right? So on what are the sources still behind it? How far can you trust the answers that you're getting? That's still one thing. But especially if you look at the let's say B2B space, for example, there's a lot of stuff happening in automation now for patient flows in hospitals, right? You can use AI perfectly to analyze large data sets that are in the EHR systems of hospitals, right? Which you normally would not have been able to do so. Would have taken you like months and would have been super expensive. So there are new areas that definitely are moving the needle.
Interesting. If you were to pick 3 to 5 top subsectors within health tech, and let's leave out your like gut blood testing or whatever, because I also think that is, but I think that's now. But in the next 3 to 5 years, the big health tech sectors that are going to blow up right here in the region, starting in Dubai, what would you predict?
Although I want to leave it out, I have to mention that entire preventive wellness, right? Once it all comes together and goes into actionable insights, that's one, okay? But then there's this entire space around AI or still automation in clinical workflows, right? Because a lot of care, but not only here, everywhere, still is disorganized, sometimes very expensive, etc. So that entire space will help to bring down costs, make it more efficient, right? And then hopefully also give time back to the HCPs, etc. Less admin, higher delivering higher quality of care, etc. That's one. I still believe, so blockchain was a huge hype years ago, right?
Was it mostly around like data sovereignty?
Yeah, but that entire thing on how you use the blockchain to make it secure, trustable, to being able to verify that the data, for example, if you use it in a process where you get data out of a lab, that the data hasn't been edited, modified.
Yeah. Is that a real concern?
Look, there are, again, not here, but if you look at EU, there are also new regulations on certain technology that you have to use in critical infrastructure when it comes to healthcare, for example, and how certain things are written. You could say it's blockchain, right? And I know that the hype went down. Right now, when you say I'm doing something with blockchain, everyone is like, okay, but I still believe that there's a valid
case
aspect and a use that will have this technology in the background, and then maybe no one speaks about that it is blockchain. But for the critical infrastructure to pick up again, there are certain individuals I spoke to in the past couple of weeks, especially also on that event on Monday where security related, there was a lot of blockchain, right? There were others that are in the healthcare space that also there in a security layer are looking at blockchain, right? So although then it might be more in the background, the critical infrastructure where it has to be, I think that could be an uptick as well. Besides then the B2C game and the preventive wellness, all around longevity, how everyone calls it now, preventive health, the clinical workflow. Then you have the blockchain for like the security layers, still all in healthcare. And then a fourth one, but it's all interconnected, is all around analytics. Right? Yeah. So how do you apply then all these different technologies that you have from the different use cases on these large data sets?
Right? Have the dashboards like you talked about.
Which
interesting.
Could bring us back to quantum, right? But those are my picks.
Interesting. Okay. They seem like fair bets that you can make. As you know, this podcast is called The Perfect Pitch. I'm curious, are you still receiving pitches regularly as an angel investor?
Yeah. So, but now since I also have this, since I also do like venture university, for example, like the ones that are really, really, really good, I just build up the deal flow there, and then I funnel them in, right? Okay. Because it is pre-seed, it is seed. That's the accelerator program that we want to bring here too. But if I can help.
That's so interesting. So basically, if someone pitches to you, you kind of have a first look as an angel investor yourself. If you're like, this is really great, but not really my wheelhouse, you siphon it off to
If it is valuable for the founder and valuable, for example, for that fund as well, yes, absolutely. Why not?
So you've got a Silicon Valley-based venture capital fund that you can direct your health tech ventures to. And then on the studio side, do you think you still will, like if there's a great founder out there that just started, there is really pre-seed, but they've got an amazing idea and you like love them, would you ever consider incubating them into your studio again?
So there's only a certain things you can do at a time, right? Because everyone only has 24 hours. The faster we solve the fundraising on the studio fund, that's definitely something we want to look into. Right now, to be honest, then if it is really a super good founder, I do coaching, etc. I get them in the right direction, similar as I've always been doing. Opening up the network, etc. But at this stage, I would say no, it has to be very exceptional.
Okay. It's interesting because anyone I find that's quite ambitious in the health tech space, like I often, if we have a long enough conversation, your name will come up. And I go, wow, Florian, you are such a serial networker in your space, which is probably why you are so good at what you do.
I hope in a good way.
To close off, let's do a quick fire round. What makes the perfect pitch for you? All of the pitches you've heard in your angel investing background, now looking at deals for VU partners, and also wearing your corporate venture capital hat. What has made the perfect pitch in the past?
So once AI had this, I mean, it still has a hype, but had this hype around automation on workflows and all that stuff, right? I got like 15 reach outs on LinkedIn a day, right? But every reach out was the same, right? And then all of a sudden there was this one guy, he's like, hey, been a sales rep 15 years, then I've been in customer service, all these processes are not good at all. This is a solution I developed. Can we please speak, right? I think this was one of the best hooks. I mean, the message was a little bit different, right? But one of the best hooks, at least on a cold outreach, I've seen, because you immediately saw, okay, this person somehow knows what he's speaking about, right? And then had the call, super interesting person as well, right? So it's again, how do you transport the message that people know, okay, this guy is credible, and you actually are going to believe that this is someone who's going to pull it off, right? And back to the part of a corporate, that's then how you also get people of corporates going to do a POC with you, because you need to find these right people then who open the doors inside of a large corporate, for example, which again gives you additional credibility. But that was one of the better ones. Yep. And
is it different of how a startup, if they wanted to go to a corporate venture capital, how they should approach them? Do they need to like understand what's going on internally and say, this is how we would love to plug in? Or
if I would go to a corporate venture capital arm, I would do way more due diligence in the beginning, because the corporate venture capital arms are always very much tied to the strategic areas of the corporate, right? And you really want to do the research on, do I really fit into one of these strategic pillars that they have in the webpage, and not only broadly fit, but very specifically, because otherwise,
And when you say specifically and do the due diligence, are you saying try and reach out to people that work at these companies and try and have conversations to see if there's a fit? Or is there ways that you can strategically do the due diligence without having to nab someone internally?
You can start with the webpage. Then nowadays, since you use all those nice AI tools, right, you do deep research. Let's say you are developing another diabetes solution, okay? But then you just do a super good deep research with the AI on, give me all the research projects, grant schemes, etc., where this company has been involved, not the corporate venture arm, right, but this company in the past 5 or 10 years, right? Then you get not 100% right insight, but you get a more deeper insight, right? And then you can see, oh, maybe they've done already a research project in my area 5 years ago, but okay, now let me figure out why they are not doing it anymore. So then you get to the next point, and then you check your LinkedIn, do I have any second-grade connections to someone in that company? And if someone I know has maybe a first-grade connection, can that person find out something or at least make a warm intro, right? So that's how I would do it, because otherwise you start with a call, then you want to have a second call, a third call.
Yeah, I love it. So practical, so clear. Last but not least, what has been the best advice you've received in your lifetime that you can share with the startup founders and other investors that tune into this podcast?
Best advice. And it sounds so cliche again, but it was somehow a connected advice, but it's always follow and do what you love the most, right? Because then it doesn't feel like work, even if you work 24/7, right? So that's one. But at the same time, surround yourself really with people who are going to support you, right? And by the time that you're doing certain steps, you see pretty fast on who drops off and who's still somehow on the bandwagon pushing you. In the first place, at least in my case, is always the family, right? So I have this great support system of my wife, my son, etc. Because when you go entrepreneur again, this is not only you that you're going to push through that entire process, right? So you're going to do it more thoroughly, etc. than when you are in your 20s, right? And by yourself. That's one. But the support system you have, the friends that support you, those are most likely, if you do a one-time startup, these are first the ones who are either going to be your angels, who are supporting you. And then beyond that, those are going to be the ones who you can speak to in the difficult times, but also the ones who are going to do introductions, right? So I had, in my case, family always, but if you look at the friends around, the network around, maybe some of the people those are the ones you met when my name pops up, but the support we are getting through introductions, people offering help, technology credits, whatever it is, it's amazing. So love what you do what you love, and have a proper support system of friends and family.
I love it. If you have that, then everything falls into place.
Yeah.
Florian, thank you so much for your time today. It's been an absolute pleasure hearing you and your love of everything healthcare and health tech. And I wish you the best in your new endeavors.
Thank you very much. It was lovely being here.
Hey there. Thanks for joining this conversation. If you enjoyed that episode and you want to start researching potential investors for your startup's fundraising strategy, go to lucidityinsights.com and sign up now to the startup registration package by clicking the plans button on the top right corner. We look forward to having you join our future conversations and checking out our additional content. Until next time, stay hungry and stay humble.